to the emergency room is the last thing parents want for their kids. Keeping them out of the ER is even more difficult if youth are caught up in a life of crime. But researchers in Winnipeg think they found a way to fight the problem. CTV's Josh Crabb explains.
In his late teens, violence on the streets left Billy Dewberry seriously injured and landed him multiple trips to the emergency room.
I know what it's like, for these youth coming into the emergency room and not having too much support to go from. Last
year, Health Sciences Centre treated more than 1,000 youth for a variety of serious injuries. Within the next year, 20%, about 200 of those patients, returned to the ER with another injury from violence.
We'll see anything from being beaten up, but serious enough to show up in an emergency department, through to being stabbed and shot by a gun.
In hospital, their injuries will get treated, but the social problems troubled youth live with often persist.
They're sent back out to, wherever they came from, and, chances are that the circumstances in their life are going to have them, return to the emergency room once again.
Dr. Carolyn Snyder wants to break that cycle of violence and stop youth from coming back into care. The ER physician developed a new program believed to be the first of its kind in Canada, one that uses support workers to help victims.
They work to build a trust with those youth right there in the emergency department, and then we'll work with them for the next year in the community.
Because of his troubled past, Dewberry identifies with young victims.
We meet them right at bedside and we start our intervention there.
Activist Floyd Weeb says children in Winnipeg now get involved with gangs as early as 10 years old. Weeb says keeping kids out of a life of violence will bring down the number of emergency room visits.
If we can intervene at that point, I don't know what better point there is to intervene at someone.
With help from others, Billy Dewberry got his life back on track. He hopes he can do the same for other victims.
We're ready to go. We're ready to start working with youth.
Dr. Snyder says it'll take about a year before they know whether this program helps keep youth out of the emergency room. Josh Crabb, CTV News, Winnipeg.